workshop in our series. I am Dominique Bird, Head of Capacity and Capability within Improvement Cymru. It's good to see so many on here. Today's sessions will be running for 90 minutes, and so we'll be finishing at 1:30, and we will be recording parts of the workshop, not the breakout sessions, but these recordings will be available on the website by workshop 2. We'll also be using Slido, so this may be familiar to some of you. I know some of you it may be completely new. It is quite easy to use. You will need your smartphone ready, and some of you may need to download a QR scanning app to get into the Slido questions for today. But if you don't have a smartphone, don't worry, you can post your comments and responses in Zoom chat as well. So if possible, it'd be great when we get into the breakout sessions if you can have your video on. This is really helpful as it improves the quality of the conversations that we'll be having together. Please keep yourself on mute for this main session. Obviously, when we get into the breakouts, we want to hear as much as possible from you. As I've mentioned, we'll be using Slido, but also the Zoom chat box throughout. And there's a lot of us on the course, so don't worry about trying to keep up. We will be presenting a brief after workshop report that will include information from the chat, from the breakout sessions, as well as a synthesis of what's been discussed over the session. And that report will be available on our website by the next workshop. So this is the first workshop in a series of 6 with the narrative arc that runs across the series, and they were exploring the improvement skills that are needed in recovery. Each session is designed as a standalone session, so don't worry if you've only got the ability to dip in and out, that's great. If you can make all of them, that's fantastic. I would encourage you to participate in as many as you can, and there's the dates, so get them into your diary. The series aims to focus on understanding what was different about improvement during the pandemic, and we'll build on published research. And we'll be exploring what this means both for individuals' personal skills development, although we always will also want to pay attention to and help people focus on what it means for their teams, their organisations, and the wider Improvement Cymru community as well. So first off, I'd like to introduce our first speaker, Dr. John Bolton, the National Director of NHS Quality Improvement and Patient Safety and Improvement Cymru. And can you use either the Slido or the Zoom chat to add your reflections and comments? Over to you, John.
Thanks, Dom. Afternoon, everybody. Just absolutely on cue, just as my microphone starts up, the dog's barking in the background. So if you can hear a dog barking, I apologise, but he always does this in a very timely way for me. So welcome to this session. As Dom says, I'm John Bolton. I'm National Director of NHS Quality Improvement Patient Safety here at Public Health Wales, and also Director of Improvement Cymru, the National Improvement Team. So welcome to this first session. I think you're going to find it really interesting. We've got a couple of really good speakers, and it's also going to be facilitated by the team in Lab Cymru, a partnership between Q, supported by the Health Foundation, and us here in Improvement Cymru. I think you're going to find it a great session. I'm not going to speak for an awful lot of time, which I'm sure everybody will be happy to, and it'd be really great to actually hear the diversity of views within the team. So we've all perhaps had a bit of a opportunity to take a breath over the last couple of months and just reflect on what we've all been through over the last 15, 16 months. A lot's changed, a lot's been really challenging at times, but I think a lot of us also recognise about how improvement science has helped during the pandemic, but equally at the same time how at times it's been really challenging to actually do and drive improvement science over this time. But as we come to this period, just starting to think about recovery, how we apply improvement science to support the system when the system is at times very, very different, in areas very different, when perhaps we're not going to tolerate the speed of change that we once did. So it is an opportunity for us to reflect at this point. It's also an opportunity for us to think about what's different during improvement at this time, what skills, tools, techniques we've used, but what we can take forward into this period of time. So, we're going to give you the opportunity to reflect, the opportunity to actually think about this, and as Dom says, the opportunity for us to then synthesize something that will will share with you. So just before I hand over to Des and the team, a couple of things for me just to consider and a few provocations. So whether you've been working through improvement over the last 12, 18 months, or you're starting to think about it again, really start to think about it. We've got all of these different tools, methodologies now about how we can bring people together, how we can ensure that really wide and diverse opinions that have been represented or we need to represent. How can we initiate change in different ways, or how have we done it over the course of the pandemic? What different tools, techniques, technologies have we used? And how have we used creativity and problem solving in very, very different ways, and how we can again use them going forward. So I'm sure I could sit here and probably give you numerous examples of work that we've done within Public Health Wales, but what I think I'd much rather hear is your experiences and where you think that improvement needs to go going forwards. And it would be great to actually collate that and synthesize this over the course of this session. So great opportunity to reflect, but let's really think about how we can use these skills, techniques going forward to support recovery in the next 2 to 3 years. So enjoy the session. I'm looking forward to it. I'm hopefully going to be bobbling around in the background over the next hour and a half. So look forward to hearing all of your views. And I'm going to hand over to Des. Thank you very much.
Thanks, John. It's back to me at the minute. Sue has popped into the chat box. Please, any comments or reflections that you've initially got, as our speakers are sharing their views, please pop all your comments in the chat box and we will make sure that those contribute to that overall workshop report. Okay, so here are some of the principles of how we're going to learn together over these sessions. These are really interactive sessions, and we've designed activities to support you to have useful conversations by learning together through collaborative and peer learning. We also want this to be a safe and supportive space for people to share openly with each other, recognising that this has been a very difficult time for many of us and continues to be for some. Each session in the series is shaped by the feedback that we receive from you. So thank you initially for completing the Survey Monkey, and we'll be asking you to vote on some choices again at the end of every workshop. We aim to give you the time and the space to process your thoughts in breakout rooms, and some time at the end for individual silent reflection and consideration of the learnings and actions that you may wish to take forward. So let's meet the team who are supporting you today. So for those of you who aren't familiar, Lab Cymru is an initiative to improve health and care for people in Wales. It's a partnership between Improvement Cymru and Q with funding from the Health Foundation, and we're delighted to have partners from Q with us today. So here's the team who will be supporting the workshop today. Myself and Des Brown, Lab Programme Lead, will be hosting the session. We have Sue and Emma providing support for logistics, and breakout facilitation from Mandy, Mark and Beth from Improvement Cymru, and Libby, Henry and Joe from Q, the Health Foundation. So over to you, Des.
That's great. Thank you, Don. Hello, everybody. So before we move on to our next speaker, I'd just like to ask a couple of, for us, really important questions. So what we'd like to understand is what brings you here today. So we're going to open up Slido, move on, introduce our colleague, Dr. Mark Griffiths. Mark's going to share some of his personal and experiences, and also in the context of what's happening within Wales at the moment. Over to you, Mark.
Thank you, Des, for that introduction. I'll just try and share my screen. Oh, okay, you got it there, Mandy, I see. Okay, fabulous. Okay, so I'm Mark Griffiths. I'm the Research, Innovation and Improvement Coordination Lead within Improvement Cymru, and I'm going to talk a little bit about the NHS Wales COVID Innovation and Transformation Study Report. So next slide. And I think it's important to say at the outset that this is an NHS Wales-wide effort. So I can't take any direct credit for the work that's gone within it, but I think it's fair to say that a lot of the work was led by the commissioning team, led by Tom James and Aaron Bevan Health Board, with support from Welsh Government, Health Education Improvement Wales, and the Welsh NHS Confederation, who published the full report just recently. And the link in this presentation will be shared afterwards, so that the link is there if you want to read the full report if you haven't seen it already. And it will highlight some emerging themes that come out of that study report and how do we sustain transformation going forward. But also, what are the wider innovation challenges and the skills that have been acquired as a consequence of this? And I think it's also important to remember that COVID-19, whilst the response phase was a very acute, steep learning period, we're still within the recovery period of COVID. There are still innovations that are ongoing and improvements that are happening, and there are opportunities that have been lost also, so it's probably important to recognize that. Next slide, please, Mandy. So just to set the policy context for this, back in January 2018, long before COVID was even a twinkle in a bat's eye, the Parliamentary Review for Health and Social Care recognised that health and social care within Wales at this time and into the future was unsustainable, and that radical transformation was needed to address some of the shortcomings and shortfalls within the system. So it was a recommendation that what was needed were national models of scaled up seamless care from local and regional implementation based upon the quadruple aims for research, innovation and improvement, based around the prevention agenda, improved quality and value with an engaged workforce. So next slide shows how Welsh Government responded to that through publishing their action plan for a healthier Wales, which was is a 10-year vision of transforming care from a primary and secondary care-based model that we have currently predominantly, more towards prevention and a health and well-being agenda, where home-based care and self-management also is given greater priority and less reliance is put upon the primary and secondary care services through health and social care as we currently see it. Next slide. But then in late 2019, early 2020, COVID came along and stopped play for many services. This was a disaster, and if you click on next, and for some it wasn't so bad. For others, it was, well, it probably was a blessing in disguise, but no worries, all you Little Mix fans, I'm sure they will be back in Wales at some point to give us their dulcet tones. So the next slide really reflects some of the learnings that came out of the survey work from that innovation and transformation study and the emerging themes that we see as a consequence of it. And I think it's important to stress at the outset, this is very much an individualized reflection and that people's experiences differed greatly. But the emerging theme suggested that what came out of this was a changing culture born out of necessity, this wartime mentality in collectively dealing with the issues that the pandemic proposed for us. There was an agile use of resources, staff were redeployed, and the digital transformation agenda enabled us to cope with the new landscape that we found ourselves within. But there were mixed availability of resources and funding to support innovation and improvement activities. So it wasn't a clear picture across all settings. In terms of decision making, this seemed to reflect a reduced governance and an increased space to innovate and practice improvements in activity, with fewer spans of control and less layers of authorization, for example, when it comes to financial delegations of authority. But staff equally felt that they needed, and sometimes they were given, the space and the permission to practice innovations or improvements in service delivery. This was supported with staff well-being and support frameworks, which enabled many to either work in very stressful clinical environments or within the home setting, a space that they hadn't perhaps been able to work in before because of their local circumstances. Another key finding from the report was that multidisciplinary team working was facilitated. It was much easier than previously. So networking was a lot easier between and within organizations, and a community resilience was built up around this. Next slide, please, Mandy. But then sustaining this transformation around improvement and innovation has proven challenging. There are some concerns over a loss of momentum and a return to the status quo. So whilst it's recognized that a number of service delivery changes have led to improvements in either staff or service users' experiences and outcomes. A lot of this is really anecdotal, and more evaluation needs to take place of these activities to understand and evidence the impacts that have happened. To support this, it's recommended that change champions or innovation champions are created within organizations to support future innovations and to maintain the momentum that's been built up, alongside an infrastructure that's enabled to capture these opportunities, co-produced together with the staff and the other service users who will come to benefit from them. Digital inclusion assessments came out of the study report also, suggesting that we need to really consider what is the digital literacy
Hi, Mark. I think you've somehow gone on mute.
There we go. Yeah, you can hear me again. I think I lost you around about when I was talking around digital inclusion and the digital inclusion assessments to support transformation. So what I was saying is that the report highlights that we need to understand what the digital literacy of staff and service users of those services will be in the future so that we can support this going forward. Also to understand what are the access issues to digital technologies in the future, and the operability of the systems and people's abilities to use these systems, and to increase collegiality, so to support multidisciplinary working and reduce bureaucracy through lowered hierarchy. Next slide, please, Mandy. So within Public Health Wales, there's been a lot of work ongoing in the innovation and improvement space. Next slide. So our forward internet pages have highlighted the digital transformation that's gone on internally with data dashboards. If you click on next, so public-facing information on the response to the pandemic, and next, with a lot of well-being resources for staff and members of the public. Staff themselves have been supported. We have been supported to work from home with software such as Microsoft Teams and other platforms such as Zoom, with digital champions that have been set up to support this work. We created a national contact center across various sites, and what this enabled was for staff to be able to provide a public health service, both to health professionals and members of the public, and regional national health protection response cells provide advice to local authorities and particular social care settings. This involved developing a whole new set of skills around agility and flexibility in work, a change to our styles of working with different mindsets and mental resilience to cope with a much more pressured environment than perhaps many staff previously been accustomed to, myself included. We were supported with a number of tools to help us to deliver these services and protocols that were regularly updated, but that oftentimes weren't adequate to meet the requirements of the task because there was so much information coming in, which was changing up all the time. So a number of skills were required in becoming used to different data sets and dashboards. So training was provided virtually or through a socially distanced group training, and peer support became a large part of our working also in supporting new staff who are onboarded throughout the course of the pandemic, and also off-boarded to support other services. So we were working with greater time pressures and more time constraints over a longer period of time. This is supported, of course, also by a number of health protection responses, such as whole genome sequencing and service changes to microbiology, testing and sampling that was set up by the organization, and new laboratories that were established also. Next slide. So I think a lot of what has happened reflects the 6 evidence-based principles espoused by the Accelerated Access Collaborative and the Care Quality Commission, in which they suggest that what we need to focus on going forward to sustain this activity is to develop and deploy innovations with people that will use them, supported by a culture where innovation can happen through people and staff being given the time to develop and deliver ideas, sharing their best ideas and the learning that comes out of it, with an emphasis upon evaluating the outcomes and the impact of the work, and a flexibility to manage change as and when it occurs. And the final slide is to say that there are a number of resources that are coming out all the time to support innovations and improvements, such as the new digital resource launched by Life Sciences Hub Wales. I would encourage you to take a look at these, and they are dynamic and ongoing and constantly updated. And if there is time for questions, I don't know if there are at this stage or maybe later, but I'm happy to take any questions. Thank you.
We're going to take questions following the next speaker. Okay, that's really insightful and I think thought-provoking for us. So I'm just going to introduce Henry Can, a colleague from Kew in the Health Foundation. Henry has been involved in some recent research, which has resulted in an insights report for the Health Foundation, and Henry's going to share some key learnings and themes emerging from that recent research. Over to you, Henry.
Thanks, Des. So, hi, I'm Henry. I'm the Evaluation and Insight Officer for Kew, which is based at the Health Foundation. And I'm going to speedily talk you through some of our learning from Kew members about the role of improvement during their work in response to COVID-19. So first slide, please, Mandy. So getting straight into it, we undertook 2 projects with Kew members in 2020 and 2021 to capture learning about the role of improvement during the pandemic. The first captured emerging learning from the rapid implementation of video consultations between March and June 2020, and 50 participants contributed learning logs every fortnight for 12 weeks to capture live reflections and learning. And then we summarized and shared that as blogs on the Kew website. If you could click again. Thanks. And then we did a member-wide survey on the role of improvement more generally during the response to COVID-19. We had 225 responses and actually followed up with 10 depth interviews in December. So I'm going to touch on 2 key findings from the work. First was that individuals were able to apply their improvement skills and capabilities during the pandemic. And second, how this was more effective actually in organizations with existing improvement cultures and capabilities. Next slide, please. So the definition on screen kind of highlights that improvement is about a systematic approach that uses specific methods and tools to bring about improvement. But it also draws out that what's really key is the people, as you all know, and giving them time, permission, and skills to do that work. And it's important because there's a point when obviously in a crisis, the rubber meets the road and improvers have to find that time for improvement activities amongst their routine work. And a key research question was therefore whether this happened in practice. Next slide, please. So if you could, that's perfect. So this is an example of how 2 members described it, talking about their experiences in the early phases of the pandemic response. Firstly, you've got, I'm a quality improvement nurse, but you're valued more for your hands than you are for your quality improvement expertise, by which he was actually referring to as nursing registration, although it's quite a nice metaphor. And secondly, when COVID hit, the message from senior managers was QI stop, everything stop. QI is seen as a luxury that can be stopped. And that need to prioritize and focus efforts during this time kind of makes sense. And I think we'd all agree with that. But our research from members was also showing us the value of an improvement approach, even in the most challenging of situations. Next slide, please. Yeah, brilliant. So as this member described in the sort of bubble on the right, people do get energy and feel validated when they are listened to, and QI equips people to involve and engage others through that change. And we saw the sort of enabling effects of QI approaches and projects, which range really widely from setting up COVID testing sites to the production of PPE and its distribution to actually running wellbeing sessions to support community nurses. But at the end of the day, applying these principles and making sure this work was happening despite competing priorities were people who had the right capability, confidence, autonomy, and authority, and that's really important. And I mean, amongst many examples, we actually heard how improvement expertise helped improvers to use tools and techniques to understand a problem, for example, and to structure small tests of change and some rapid improvement. But when prompted to think actually about what enabled this work, actually, if you could just click once more, I think. Yeah, when prompted to think more about what enabled this work, people reflected that actually an improvement mindset encouraged reflective questioning and strategic thinking, with a willingness to just keep at things that didn't really necessarily go right the first time. So sort of willingness to fail. But over and above these sort of individual level skills and competencies enabling improvement, there was also an organizational and leadership context and culture that was also really important to how people delivered this work in practice. And that was just as important, we found, as time and capacity. So accordingly, quite a lot of the variation we covered in terms of whether and what improvement was taking place was actually influenced by these organizational contexts, either supporting or obstructing improvement. Next slide, please. So in fact, a really key learning from our work is how improvement played a more important, valuable and strategic role during COVID-19 in organizations that had a well-developed approach to improvement pre-pandemic. And if you could just click again, thanks. So one participant really captured something that resonated with us when they described it as a sort of muscle memory kicking in, as you see on this slide. And what we found was that a sort of muscle memory could reside not just in individuals, but also organizations, and those with better developed individual and organizational improvement muscles, as it were usually more able to use their skills with a sort of rigor and intentionality. And we think that altogether, these insights help create a bit of a case for why investing in improvement skills and capabilities should be part of what organizations do to enable the recovery. So final slide, please. That's been a super quick, but I hope useful whistle-stop tour of some of our learning. And I'll just end by pointing out that we're continuing to explore the themes further, including into our new insights project, focusing on the backlogs in health and care. You can find out more and also information on joining Q by visiting our website. So thanks very much, and I really hope you enjoy the reflective sessions coming.